A very warm welcome to this edition of our program, Let's Talk Health Cardiology Queries. I'm Nidhi Kumar and you're watching India Science. Well, India's cumulative COVID-19 vaccination coverage exceeds 196 crores today. India reported 12,781 new COVID cases. More than 2.8 lakh vaccine doses have been administered in the last 24 hours and the recovery rate currently stands at 98.61%. As COVID-19 continues to surge in the country, COVID-related queries are on the go. People are speculating about many doses and its effects also. In this program, where we take your questions from Facebook and YouTube Live, today we are joined by the very eminent Dr. Sundeep Mishra, Vice Chancellor and President, NIMS University and Director, Cardiological Sciences at the NIMS Hospital, Jaipur. Many thanks for joining us and namaste and welcome to India Science, sir.
Namaste.
Please tell our viewers about the current cardiological disease scenario in India in view of the new cases and the new strains. How do you prioritize cardiological management in such times? Is there any specific protocol that you're following at Jaipur?
So, see, the thing is that, when this COVID pandemic is ongoing, so it puts the cardiac patients at certain risk. Particularly, what it does is that it is a virus, and the main problem is that this virus lead to an immune response, and that immune response, once it gets out of control, which what we called as the autoimmune or the autoimmune crisis, then it affects many organs, including lungs and also including heart. So in the heart, what it does is this autoimmune reaction causes irritation or inflammation, and that leads to a specific condition in the heart muscle, which is called as myocarditis. At the same time, what it can do is that the heart is supplied by certain blood vessels, which is responsible for nutrition of the heart. Those blood vessels also get inflamed, and that can lead to development of problems like heart attack and acute coronary syndrome. And so these are some of the things. Finally, what can happen is that this irritation of the muscle and irritation of the other parts can lead to formation of clot and can lead to a situation called as pulmonary embolism. So these are some of the things that can commonly occur due to COVID affecting the heart or cardiovascular system.
Right, doctor. So that is about protocol. Now I would like to ask you about people who are suffering with cardiac problems during this period. Is it normal to have low blood pressure post COVID-19?
So look, the COVID. Let me explain a little bit so that everybody will understand what COVID does to heart. Number one, as I said, it is initially a viremia. So virus can affect different parts of the body. Typically, the virus is located in the upper respiratory tract, in the buccal mucosa, and in the throat part. But it sometimes, when it gets severe, then it can affect various organs and it can cause viremia, and that can affect heart. That is number one. But that is, remember, very uncommon. That viremia of a lot of viremia that can affect heart, that is very, very uncommon. What commonly happens is once the viremia subsides, the body responds to this virus by producing immune cells, and there is a cellular and a humoral immune response against the virus. And this immune response can lead to a crisis where a lot of immune cells and a lot of immunity and inflammatory products are produced, and those products can cause harm to not only heart but other organs, as I already discussed, like lungs and the kidney. Now, this is a common time when this viral is most destructive, or the response against the virus is most destructive, and it causes a lot of problems. But there is a third phase also. After this immune response has also subsided or abated to a great extent, and that is known as a long COVID or post-COVID situation. Here, what happens is most of the inflammatory response, most of the response comes down, but still some smoldering inflammatory response persists, and that can affect the blood vessels supplying the heart and other organs, and that can, after the COVID gets treated, also after even months after that or weeks after that, can affect the blood vessels and cause heart attacks. Likewise, this kind of slow moldering infection can even cause myocarditis. Now, cause of low blood pressure in this COVID situation can be many. Number one, it can be once somebody develops heart attack, then lot of myocardium gets jeopardized, and then blood, as you know, is a pump. So blood is unable to pump enough blood because a lot of it gets affected by heart attack, and therefore there can be lead to fall in blood pressure. The other thing that can happen is that because this whether virus does it or whether the immune response to virus, it affects the muscle of the heart. And as you know, that muscle is the one which pumps blood. So once the muscles get affected primarily, then again it causes myocarditis and can lead to heart failure, and then again blood pressure can drop. But commonly what COVID does is, after COVID has been treated and after person is declared COVID negative, is that it can affect the autonomic nervous system affecting an heart, and it can cause tachycardia, which is very common in post-COVID patients or long COVID disease. A lot of patients will have just increase in heart rate and nothing else. And they don't know what has happened. They just say that we had COVID, we got treated, but heart rate is high still, and it persists for a long time, maybe few months even, and that is because of this long COVID affecting autonomic nervous system of the heart.
Yes, doctor. I have a question on YouTube now, and this comes from Shivam from Dehradun, and he needs to ask us that he has to undergo a heart surgery, but he has not taken his booster jab. So is it safe for him to take the vaccine after the surgery or before that?
Look, when somebody is undergoing surgery, he's coming into contact with a lot of individuals. Of course, there are doctors, there are surgeons, there are anesthetists. All of them will be taking adequate precaution. But even adequate precaution cannot prevent 100% of the times this infection. Plus, he might be exposed to some other personnel also, ward boys and other lab technicians, others who may not very rigorously follow the same precautions which doctors or surgeons or anesthetists would be doing. So there will be a bit of increased risk. Finally, as I said, even after full vaccination, even after taking all the precautions, very small risk still persists. So my feeling is it is better to get the shot before going for any kind of surgery to take care of this additional risk that will happen when somebody comes into contact with a lot of individuals.
Absolutely. So Shivam, you get your answer. We have yet another question on YouTube. This time this comes from Dolly from Hyderabad, and she wants to know that her aunt has been diagnosed with arrhythmias. Can you please explain this disease and also the high risks and precautions that she needs to take?
So basically, the heart is a pump. Basically, it is, if you boil it down to what it does to the engineering part or the mechanical part, it is a pump. But pump has to be coordinated. That is, blood should flow in only one direction. To make that happen, there is a valve there, which allows blood only to flow in one direction, so that blood does not come back. So that is one mechanism. The other thing is that heart beats rhythmically. So first, the upper part of the heart beats, and then the conduction leads to the lower part of the heart, and then it beats. Once that lower part beats, it pushes blood forward into the aorta or the great vessel and supplies whole of the body, and the valves prevent the blood to come back into the upper chambers. So that coordinated movement happens through the electrical circuitry of the heart. So the heart has got an electric circuit, whereupon when the contraction starts or the beating starts, first the uppermost part contracts and pushes all the blood into the lower part, and then the lower part contracts and pushes all the blood into the great vessels, preventing the valves, preventing the blood from going to the upper part of the heart. So this coordinated electrical activity is very important for proper functioning of the heart. When this coordinated electrical activity is lost because of various reasons, we call it arrhythmia. Now, there are two kinds of rhythm disturbances that can happen. Number one, that the impulse that leads to coordinated contraction does not properly travel down. So it gets blocked somewhere. So once it gets blocked somewhere, whether it gets blocked at the origin or whether it gets blocked at a node, basically, which connects the upper part of the heart called atria with ventricle. So there is in between a node that is called the AV node. So the impulse can get blocked either where it is generated, which is called the sinus, or it can get blocked at the AV node where it is called a complete heart block. So one type of arrhythmias are these slow, and what it does is once this beat cannot conduct properly, it leads to reduction in the heart rate. So normal heart rate we know varies from 60 to 90, but if there are blocks somewhere, then the rate can fall to less than 60, maybe 50, 40, 30, 20 even. So this kind of arrhythmia is called a bradyarrhythmia, whereas it leads to a slower heart rate. The second thing that can happen is that when this electrical conduction is happening, there can be short circuit somewhere. So what can happen is instead of moving forward, it can rotate in a circle. And once it rotates in the circle, again and again, once it rotates, it can stimulate the AV node again and again, and then it can lead to tachycardia or tachyarrhythmias. So two types of arrhythmias can happen. Sometimes when short circuits happen, it leads to tachyarrhythmias, or it can even lead to atrial fibrillation, where the atria short circuit happens in the atria, then it can cause atrial fibrillation. It can cause AVNRT when there is a circus kind of short circuit, and when the short circuit happens in the ventricle, it causes ventricular arrhythmia, ventricular tachycardia, or even ventricular fibrillation. Please note that once ventricular fibrillation happens in heart, the person can die. So the immediate treatment at that point of time, once ventricular fibrillation is happening, is a DC shock, a shock that is absolutely necessary. Otherwise, the person can die. So broadly, two types of arrhythmias: bradyarrhythmias, tachyarrhythmias. When bradyarrhythmia appears on the upper part of the heart, it is called sixth sinus disease. When it appears in the lower part of the heart, it is called a AV nodal disease or a complete heart block. And when the tachyarrhythmias happen in the upper part or the atria, it is called atrial fibrillation. When it happens in the lower part, that is ventricle, it can be called ventricular tachycardia or ventricular fibrillation.
Yes, sir. Doctor, now I request you to please explain the term stress cardiomyopathy.
So normally, look, as I said, what happens is normally heart is supplied by blood vessel. So funny thing about heart is that it is a pump, so it contains a lot of blood inside it. But interestingly, it cannot use this blood for its own nourishment. And that blood is only for pumping, it is not for heart's nourishment. Heart can get nourishment only from special blood vessels that come from great arteries called coronary arteries. So normally, when these arteries get blocked, we develop something called heart attack. And once these arteries are blocked, we can have heart attack, and that is the common thing. But sometimes we get heart attack like situation in the heart, even without these arteries not getting blocked, just merely because of a stress. And that kind of thing is called a stress cardiomyopathy or broken heart, or Takotsubo syndrome it is called. It's called this. So that syndrome can happen even when artery is not blocked, but just because of very severe stress.
Yes, doctor. We have another question on our YouTube. Dushyant from Manipur. And he wants to know, sir, although COVID-19 is a primary respiratory disease, 20% of patients develop severe cardiac symptoms with hypertension. Have you had experience with intra-aortic balloon pump or ECMO, or the difference between ECMO and ventricular assisting device in this setting?
So, look, what he's trying to ask is that when this infection or inflammation happens of the heart muscle, now it could be because of viremia, which is very, very rare, as I told you. Mostly it is because of the immune response that body mounts against the virus, and that hyperimmune response can lead to affection of the muscles. So there is an inflammation of the muscles. It's kind of like irritation of the muscle or inflammation of the muscle. And once the muscles, heart muscles, which are basically a pump, get inflamed or irritated, they cannot pump properly. So there is a drop in blood pressure, as I told you already. Now, if this blood pressure keeps falling, then person can die. So the only way to salvage this individual is to put a ventricular assisted device, something which can help ventricle in pumping blood. So there are various kinds of these devices. The simplest one is IABP, or intra-aortic balloon pump, where what happens is that because the ventricle is pumping into aorta, so there is a small pump in the aorta which can take away some of the function of the ventricle and help ventricle do the correct thing, that is the push the blood forward, and so it can to some extent maintain the blood pressure. But when the depression is very severe, then this outside pump may not help that much, and then you may require pump inside the ventricle. And so that pump inside the ventricle is called a ventricular assist device that you may require in a severe situation. And then finally what happens is that normally the left side of heart is important for pumping, and that is what pumps, but right side of the heart is responsible for pumping blood into the lungs. When there is lot of depression, then both sides of the heart stop pumping, and then you may require something called ECMO, which can pump blood both in the right and the left side. So depending on the severity of the situation and depending on type of depression, whether it is only ventricular depression or whether it is whether it is only left ventricular depression or whether there is some right side also involved, you can put any of these devices. So at All India Institute of Medical Sciences and many other places where I'm now in NIMS University, also we have these pumps. The intra-aortic balloon pumps are available, and we use them extensively to salvage these kind of situations. Although commonly we require this pump for heart attack kind of situations, where because of heart attack the heart does not pump enough blood, or when somebody is going for bypass surgery, then temporarily you may want to support, give the support of heart, because temporarily you have to stop the heart, and therefore at that point of time you could use these intra-aortic balloon pumps and other kind of devices surgically.
Yes, doctor. My next question is, studies suggest that cytokine storm is a serious coronavirus complication. What exactly is a cytokine storm and how does it affect the heart, sir?
So as I told you a bit earlier, that the first stage is viremia, where virus circulates in the blood and can affect the organs. Normally, typically, that is not responsible for any complications in COVID cases. Typically, very rarely it can cause complications. Normally in COVID cases, this virus does not cause the problem. It is the defense mechanism that body mounts against the virus that is actually harming the body itself, and that is why we call it autoimmune response. Now it can do two types of things. One, it can give rise to inflammatory markers. So inflammation can be increased, and because of inflammation, normally what happens is when there is any infection somewhere, then typical thing is that there is an inflammation, and then blood supply to that part increases, and then lot of defense cells which can fight against that virus or bacteria go there. So inflammation is normally a defense mechanism to any kind of infection, whether it is viral infection, whether it is bacterial infection, whether it is fungal infection, whether it is any kind of infection. Inflammation is actually a defense mechanism. Likewise, once inflammation happens, a lot of cells go there which are inflammatory cells. They can be neutrophils, they can be immune cells, which can give rise to humoral immunity, or it can be cell-based immunity, where cells fight against these viruses or bacteria, or some antibodies fight against these viruses and bacteria. So these are three types of defense mechanisms. One is inflammation, second is cellular immunity, and third is humoral immunity, where antibodies are formed against the virus or bacteria and antibodies fight against them. Now what happens in COVID, unfortunately, is that many cases this difference response is out of proportion and much more than what is required to just beat the virus. So it is a overreaction by the body actually, and that overreaction leads to a lot of production of cytokines, which are these inflammatory markers. And basically what it means is when cytokine storm is happening, that lot of inflammation is happening, which is much out of proportion to what is required to just beat the virus. It is much more than that, and that excessive response actually not only beats the virus but also starts acting against our own body, and that is why it is called auto, means against our own body. This inflammation starts acting, and likewise the immunity also starts acting, and that thing is known as cytokine storm. And typically with COVID, cytokine storm is more serious complication than the actual virus. So I hope I have clarified.
Absolutely. Yes, sir. What is the treatment for heart valves, diseases of heart valves? Can the heart valves get affected in old age, and how does one address this issue?
So typically heart valves are involved in three conditions. One is old age condition, which is common in Western world, and it is when the age goes on, because valve, remember, closes and opens according to flow of blood, and over a period of time with age, these valves start degenerating, and then they develop degenerated valves. The other condition is that there is an infection that can happen, and that can cause rheumatic fever and rheumatic heart disease. So that is the second condition that can happen, and that can infect the valves. The third thing is a congenital heart disease. That is, the valves are defective right from the beginning, and because of defective valves, wear and tear is more common there, and that can lead to quick degeneration of the valves, and that is known as congenital heart disease. So these are typically three conditions. The treatment of the valves classically was surgery or valve replacement, or at least opening up of the valve if there is a lot of narrowing. But nowadays what has happened is that a lot of non-surgical interventional treatments are available. You could do balloon dilatation if there is a narrow valve, or you could even do a valve replacement, percutaneous valve replacement, percutaneous aortic valve replacement, and percutaneous mitral valve replacement, or even tricuspid valve replacement, without doing surgery. Just from the groin you can insert a artificial valve inside the valve.
Yes, doctor. You just mentioned about rheumatic heart disease. Interestingly, my next question is that only. How does one get to know if he or she has a congenital or a rheumatic heart disease? What is the basic way of addressing these, if not concerned with the valves?
Yeah, so basically, valve disease is one type of either congenital heart disease or rheumatic heart disease. There can be other types of diseases as well. Rheumatic heart disease mostly is a valve disease. It can cause some other things. It can cause rheumatic fever, myocarditis also sometimes, or rarely it can cause some other kind of complications. But not typically, rheumatic heart disease is mostly a valve disease. But congenital disease can be many things. It can either be narrowing of the valves, or it can even be holes inside the heart. So that can also happen. So congenital disease are broadly classified into either narrowings or holes. So holes have other set of treatment, narrowings have got, or leakages have got a different type of treatment. Now, how to diagnose them? Typically, as I said, congenital heart disease are present right from the birth, and they keep happening over a period of time. But rheumatic heart disease are usually acquired in a school going age. So typically, about 5 to 15 years, when children go to school, at that point of time, they may acquire the rheumatic heart disease or rheumatic fever, and that leads to rheumatic heart disease. How to diagnose them? I think the best way to do it is by echocardiography. And there are certain signs which, if present, take you to the diagnosis of uh, congenital heart disease, and there are certain other signs in the echocardiography which can take you to the diagnosis of rheumatic heart disease. Although there are certain criteria set for diagnosing rheumatic heart disease or rheumatic fever at least, but simply nowadays cardiologists, if they are good, then they can, by just doing echocardiography, differentiate between these two conditions.
Yes, doctor. My next question now is about the aerotic valve disease. What is the treatment for this, and what exactly is this kind of disease?
So basically, if you remember, I told you that it is the ventricle which pushes blood, particularly the left ventricle, which pushes blood into the great arteries which supply a whole of the body. Again, when the between the ventricle and the great vessel which supplies the blood, which is called aorta in technical language, there is a valve there. So that blood flows only in the forward direction from the ventricle into aorta. Now that valve is called as aortic valve. Now that valve can have two kinds of problems, or let us say three kinds of problems. Number one is that it can get narrowed, which is called aortic stenosis. or this can get leaking, which is called regurgitation, or non-coapting or leaking, that is called regurgitation. And third thing is that some infection can develop on the valves called a bacterial endocarditis. So these three kind of things can happen. And treatment for the first type, which is the narrowing, nowadays is either surgery, bypass surgery, you can replace the valve, or as I told you, you can do a percutaneous valve replacement. For leakage, generally majority of the cases you would go for surgery. There are some situations where you could even put a valve there. But for infection, first of all, you try to treat infection by giving antibiotics for 6 weeks or more. And if the infection gets treated, then that is okay. If it does not get treated, or if it gets worse during the course of treatment, you might have to do a surgery for infective endocarditis.
Yes, doctor. Then I'd like to again request you to please answer and explain broken heart syndrome, and does it have any kind of treatable ways to uh, undo this kind of damage of a broken heart syndrome, and where is it found generally? Why is it found?
So broken heart is also kind of a stress myopathy. In original term was Takotsubo cardiomyopathy, where even though there is no blockage in the coronary arteries, the heart muscles get suddenly weak because of excessive stress. And so broken heart because somebody, some let us say a wife runs away, or some lover goes away, then the heart gets broken. Actually what it means is there is a lot of stress, and that stress can lead to this kind of situation where it mimics, or it looks like a heart attack, but if you do angiography, you realize that coronary arteries are normal. Now, the good news is that majority of the cases, they become normal on their own if you just take care of the stress and just reassure the patient. Then by themselves, these hearts can recover, because there is no organic problem, there is no blockade, etc. anywhere. So it gets recovered by its own. You just have to wait, and majority of the cases it recovers.
Sir, I'd like to ask you now, what is the accuracy level of the local oximeters? I'm not sure whether this is the right question, but it's come to us.
So I think it depends on the companies. Obviously, if I manufacture some oximeter at my house, it will not be as accurate as a standard kind of oximeter. So basically, I think important thing is that there could be a variation in the values by these local oximeters, and it is important to make sure that you are using oximeter of a good company, of a standard company, and you may in between also get your oximeter calibrated by a standard oximeter and see whether it is giving a normal value.
Right,
But
doctor.
the other thing that can also happen is that properly applying the oximeter is, I think, a more common problem, where people don't properly apply the oximeter, and then it gives the fallacious readings. So you have to see that normally good oximeters have got a trace. So unless you see a good trace, the value of oximeter should not be taken as final.
Right, doctor. And now I come to another YouTube question. This time it's coming from Kerala, and Ananya wants to know, is swelling in both lower legs a sign of heart failure? And she also wants to know, what is pericarditis?
So swelling in both lower limbs can be one of the causes, can be heart failure, and actually a pretty common cause. But there can be some other causes also. There can be a lot of other causes also, actually, as a matter of fact. And it could be because of, let us say, weak liver, that can also cause swelling, or it can be because of kidney failure, that can also cause swelling. And then, of course, it can be because of heart failure, as I said. It could be even because of pure simple albumin deficiency, the protein being less in the blood, that even that can lead to swelling in the both lower legs. So it depends on the context of this swelling and what other things are associated with it. If breathlessness is associated, and if you do echocardiography and you demonstrate left ventricular dysfunction and heart failure, then it is because of heart failure. But if you don't find that you find that there is a swelling in lower limb, but heart is normal, then you have to look for other causes. You may have to look for kidney causes, or you may have to look for liver causes, and you may have to look for other causes.
And pericarditis?
got three chambers. The innermost layer is endocardium, of which the valves are made. So remember, valves are made of this particular inner layer of the heart, which is not muscle. So remember, it is not a muscular layer. It is called endocardium. The, the second layer is myocardium, which is the muscle. And this is the muscle part, which is actually the pump part of the heart, which can pump blood. And the third outermost layer is called, which is encasing this muscle, that is called pericardium. And that pericardium is a thin layer which protects heart from all the other organs inside the body, and prevents the contact between myocardium and rest of the organs of the body. So this particular thin layer is called pericardium. Sometimes, there can be two kind of problems with this particular layer. Sometimes there can be inflammation of this outermost layer, which we call pericarditis. And sometimes in between the pericardium and the myocardium, there is a very thin gap, and sometimes fluid can collect inside that small gap, and that fluid is called pericardial effusion, and that can increase in size and can actually press upon heart and cause pericardial tamponade even. So this is the importance of pericardium.
Right, doctor. And with that, I'm afraid we're running out of time. In the end, I'd like to thank you, Dr. Sundeep Mishra, for joining us today and sharing your valuable insights and educating us. And with this, friends, this is a wrap on this edition. We'll be back with more interesting episodes. Till then, get vaccinated if you haven't already. Stay safe, keep the mask up. On that note, namaskar, keep watching India Science. Thank you for watching.